Remember how, as children, we used to run barefoot through the dew, completely unaware of our own weight? It felt like our legs were carrying us, and fatigue was something abstract, disappearing in 5 minutes of rest. Now, when I look at my patients, I increasingly see in their eyes not only the wisdom of years lived, but also a quiet, exhausting resignation to pain. You know that specific gait when a person steps carefully on the ground, as if the surface beneath them is thin ice. The heaviness, the hum in your calves in the evening, the aching joints that twist depending on the weather. We used to calling it age, but as a doctor with 30 years of experience, I can tell you frankly, it's not age. It's accumulated tissue and vascular fatigue, which we've simply forgotten how to relieve. Many of you are now looking at your medicine cabinets, filled with ointments and painkillers, and thinking, what else can they offer me? But the truth often lies not in an expensive tube, but in a deep understanding of how our body relieves tension. Today I want to talk to you not as a doctor from an office, but as someone who has personally experienced the value of every step. I will share with you a method that seems ridiculously simple, a special foot solution. But behind this simplicity lies serious physiology. If you spend a little time with me and watch this conversation to the very end, I will reveal to you a secret that for some reason official medicine remains silent about. This is one small detail, without which no bath or compress will provide a lasting effect. It is this lock that keeps our feet healthy, and I will definitely pass on the key to it to you. Before we delve into details, I will ask you to do 2 things, not for me but so that this important information does not get lost in the ocean of vanity. Subscribe to our channel and like this video. It will help other people, your peers, who may be rubbing their aching ankles right now, see the light at the end of the tunnel. After all, knowledge is also medicine, and sometimes the most effective. Have you ever wondered why the feet are called the second heart of a person? This tiny area contains the projections of almost all internal organs, and when we soak our feet in a properly prepared solution, we don't just wet the skin. We initiate a powerful process of osmosis and diffusion. The steam releases excess salts, removing metabolic waste products that have accumulated in the soft tissues for years, causing that very swelling and the feeling of weights on the legs. I remember one of my patients, Anna Sergeyevna. She came to me almost in despair. Doctor, I can't even walk to the store, my legs are like blocks. We didn't start with pills. We started with restoring microcirculation by acting on skin receptors. Do you know what's most surprising? Most people seek salvation in complex chemical formulas, forgetting the power of simple mineral compounds that can literally draw out inflammation. But for this process to work properly, the temperature regime and consistency must be observed. If the water is too hot, we will overload the veins. If it's too cold, we won't open the pores. The golden mean is important here, that very harmony that we often forget in the pursuit of quick results. This method, which I'll begin to tell you about right now, is not just a procedure. It's a ritual for regaining lightness, and the first fundamental element of our solution is a substance that is found in every home, but of which we use only 10% of its true potential. This is the foundation upon which all further healing is built, and understanding how it works with our blood vessels will change your understanding of home care forever. After all, it is through proper interaction with the salt balance that we open the door to the next, much deeper stage of recovery. When we talk about this first basic element of our solution, ordinary sea salt or even high-quality rock salt, many of you will smile skeptically. Doctor, why haven't we seen salt? But let's put skepticism aside and look deeper into the process. Salt in this case is not a seasoning. It is a powerful electrolyte when you dissolve it in warm water in the right proportions. You create a hypertonic environment. According to the laws of physics, fluid always flows from an area of lower salt concentration to an area of higher concentration. What does this mean for your feet? All that debris, all that toxins and excess intercellular fluid that stagnate in your ankles after a long day are literally sucked out through the pores of the skin. This is natural drainage that doesn't put a strain on the kidneys and heart. I often remember my teacher, a professor of the old school, who said, before treating a joint, cleanse the environment around it. If the tissues around your knee or ankle are swollen with hidden swelling, no medicine will simply reach them. The vessels are constricted. Try this experiment tomorrow evening. Take exactly 500 grams of salt per 5 liters of warm water. The temperature should be exactly 37-38 C. This is the temperature of our internal heat. Don't. It will be incomplete. After all, health is not the absence of disease but a reserve of strength, which we are now building together with you. You feel how logically our procedure is structured. We work layer by layer, penetrating ever deeper to the very source of your comfort, and the next step will be devoted to how to soothe not only the body but also the soul through our treatment of tired feet. The third element we will add to our cup of health is ordinary baking soda. It would seem that nothing could be simpler, but in medicine, it is often the simplest substances that have the most pronounced therapeutic effect. If you understand their biochemistry, soda is an alkali and pain, inflammation, and fatigue. Our tissues are always accompanied by acidification. When we walk for a long time or conversely move little, acidic metabolic products, including lactic acid, accumulate in the muscles and around the joints. This is what creates that burning sensation and debilitating aching. By adding soda to our salt mustard solution, we create a unique environment that gently neutralizes this acidity through the skin, but that's not all. It has an amazing property. It softens the stratum corneum so deeply that it makes it permeable for the next step of our treatment. If salt is a street cleaner sweeping away debris, a chafing agent, a fireman stoking the fire of the bloodstream, then soda is a peacemaker. It relieves irritation, soothes inflamed areas, and prepares the nerve endings for complete relaxation. I often see patients who suffer from athlete's foot or excessive sweating, which in middle age becomes not just an aesthetic problem but a gateway for infection. This alkaline component creates an environment in which pathogens simply cannot survive. I had a patient, a veteran of labor, whose feet were covered in deep, painful cracks. No expensive foot creams helped because they simply covered the problem from above. We started with garden baths as part of our complex. After 4 days, the skin became elastic, the cracks began to heal from the inside, and, most importantly, the unbearable itching that kept him awake at night disappeared. Make this a habit for the next 7 days. Take 2 tablespoons of baking soda and water. You'll feel how the water becomes soapy, soft, almost velvety. Immersing your feet in it is like lowering them into a cloud. At this moment, every cell is micro-cleansed. This action is so powerful in its delicacy that many of my colleagues call this mixture a home sanatorium. But now that we've prepared the ideal base, cleansed, warmed, and softened our tissues, it's time to add the fourth component, responsible for the restoration of the vessels and veins themselves. As we age, the walls of our veins become like old garden hoses. They lose elasticity, stretch, and knots develop. And here comes an element that has been used for centuries in folk medicine, but only recently received scientific confirmation of its effectiveness. It helps tighten the vessels from within and eliminate that bluish puffiness that so terrifies us in the morning. This fourth ingredient will be decisive in the fight for a lighter gait. It's like an invisible corset, supporting your veins while you rest. And this brings us ever closer to the final secret that will unite all our actions into a single system for longevity. After all, it's important not just to relieve pain for one evening, but to teach the body not to accumulate it again, and the next step is precisely about long-term protection for your feet. The fourth element of our healing solution is what transforms a regular hygiene procedure into deep vascular therapy. We'll be talking about regular apple cider vinegar, but it must be natural, preserving the power of live fermentation. It would seem that we just talked about the alkaline environment of baking soda. Why do we need acid? This is where medical wisdom and a subtle understanding of physiology lie. We don't mix them at once. We use vinegar as the final step in preparation, or add it in a minimal dose to correct the pH balance of the skin. If your goal is to strengthen the venous wall, why do I, as a doctor, insist on incorporating organic acids into foot care after age 50? The fact is that our veins lose tone with age. The valves inside the vessels, which should push blood upward toward the heart, begin to leak, blood stagnates, and we see these bluish nets and feel a distension in our calves. Apple cider vinegar contains a unique set of trace elements: potassium, calcium, magnesium, and most importantly, enzymes that, when applied transdermally through the skin, help narrow dilated veins and strengthen their walls. It's a kind of cold compress for the vessels, which tones them. In my practice, there was a case of Maria Ivanovna, a woman with an amazing destiny, who worked her entire life at a school, spending 6-8 hours a day on her feet. By the age of 70, her veins had become tight, painful cords. Surgeons suggested surgery. But her heart could have given up. We went the conservative route. I taught her the correct way to alternate our components, and it was the addition of apple cider vinegar to the solution that produced the firming effect. 3 weeks later, she came to see me in shoes she hadn't been able to wear for the last 2 years. The swelling had gone down and the heaviness was replaced by lightness. She then said something to me that I've remembered forever. "Doctor, I feel the ground under my feet again, not pins and needles. How does this work?" Physiologically, when we add 100 milliliters of apple cider vinegar to our bath, we create an environment that perfectly matches our skin's natural protective layer. This seals the vapors after the baking soda and salt have drawn out the toxins. We're sealing the health inside, so to speak. Moreover, acetic acid gently dissolves microscopic limescale deposits in the capillaries, which make our feet hard and insensitive. I want you to try adding this element tomorrow. You'll feel a slight pleasant tingling sensation. This is your capillaries waking up. This is a signal that the blood is beginning to circulate in small circles, reaching every nerve ending. If you do this regularly for at least 7 days, you'll notice that the skin on your legs has acquired a healthy pink tint, that age-related pallor or bluish tint has disappeared. This is the return of youthful tissue. But my friends, even this powerful mixture of salt, mustard, baking soda, and vinegar is only superficial. We've prepared the perfect foundation, cleared the riverbed. But what good is a clean riverbed if the water itself stagnates or moves too sluggishly? We've reached the 5th, final physical component, which is responsible for nourishing the bone tissue and cartilage itself. After all, pain often originates not in the skin or veins, but deep in the joint, where the cartilage has thinned and the bone has begun to rub. This 5th element is a true building material. It will restore lubrication to your joints, making their movement smooth like the years when you could dance until the early hours. And it is after this that I will reveal the most important secret, without which all of the above can only provide temporary relief. This secret concerns not what we put in the basin of water, but how we tune our body for healing in the final minutes of the procedure. Remember, we don't just treat your legs. We restore your freedom of movement, the ability to walk. With your grandchildren, go to the park without worrying about where the nearest bench is. We restore your joy in life, and the 5th element is the bridge between the simple absence of pain and the true energy of movement. This is what will nourish your ligaments from the inside, making them as elastic as a young vine. And now, I will tell you how this simple pharmacy assistant completes our magical formula, preparing you for the most important revelation that awaits us at the end. The 5th element, which completes our healing composition, is ordinary pharmacy turpentine, or even gentler and more accessible for home use, pine extract, the same one in bricks or liquid form that smells of a dense pine forest. Why do I, as a doctor, consider this component essential for those over 50? Because here we move from cleansing and toning to the deepest stage of regeneration and restoration of joint lubrication. In medicine, there is a concept called capillary therapy. Back in the early 20th century, the famous doctors Almanov proved aging is the drying out of capillaries. Our joints, knees, ankles, and the small joints of the foot do not have their own blood vessels. They are nourished diffusely, taking nutrients from the surrounding fluid. When this fluid thickens with age and the capillaries around the joint become dormant, the cartilage begins to deteriorate. It literally dries out like an old sponge. Pine extract contains terpenes, unique natural substances that have the ability to penetrate tissue to great depths. They cause microvibrations in the capillaries, causing them to open and deliver nourishment directly to the threshold of your joint. I remember my old patient, Viktor Petrovich. He was an avid summer resident, but at some point his knees and feet twisted him so tightly that he couldn't even walk. Porch. "That's it, doctor. I've finished the battle with my garden beds," he said with such indescribable melancholy in his voice that only a man accustomed to hard work could understand. We didn't limit ourselves to standard ointments. We added a pine extract to his evening baths. At first, he complained of a slight tingling, even a kind of internal ache in his bones. I reassured him. This is the blood flow awakening where it had been dormant for years. 2 weeks later, Viktor Petrovich brought me a bucket of apples from his dacha. He came himself without a cane, and his gait was confident. He didn't just relieve the pain. He restored the joint's nutrition. When you add a capful of pine extract to your warm solution of salt, soda, and mustard, you'll feel the aroma fill the room. This is also part of the therapy. Your nervous system